Hi, Dr. Somba. Hi, Dr. Kigondu.
Hello, hello. Hello, how are you? Uko
Mzuri
sawa?
sana.
That's
Karibuni.
Josephine, how are you?
I am well. Yourself?
I'm fine, and thank you very much for asking.
Okay. Karibu, karibu.
Asante sana, Josephine. Thank you,
All
Dr.
right. Okay.
We Ohasi, lakini uko na watoto?
Ai, nani wanauliza hii maswali?
Doc, we are live.
Unajua hii tuko adult session sasa bwana. Tuko adult session.
Doc, tuko live bwana.
are
Hiyo
live,
tutaongea in camera.
Give participants, those on Facebook, a few minutes, maybe another 2 minutes, and we can start. I think we are ready to go. We have 38 attendees so far, so I think we shall start.
Yeah, good to
Good
go.
evening, everybody. Okay. Good evening, everybody, and come to today's webinar. Today, we are going to talk about how we need to change our parenting skills and strategies during this time of COVID. So, karibuni to webinar. For participants, please drop any questions you may have in the Q&A section, and you can make any comments in the chat. Just remember, please, that you will receive CPD points via email following registration to this webinar. And now I'd like to acknowledge some members of the collaboration, Kenya Medical Association, Clinical Psychologists Association, Kenya, KCOA, and NANAK members. I'd also like to ask Dr. Otara, Dr. Gondu, somebody to maybe welcome the participants to this very important webinar. Dr. Otara? It seems Dr. Otara is not with us right now. Maybe Dr. Gondu and Dr. Son.
Sorry, I didn't hear you mention my name.
Oh, okay. There you are. Please say something and welcome, or say hello, and just welcome to our participants.
Good evening, everybody, and welcome to this evening's webinar. And glad to have you attend on behalf of the Kenya Medical Association. And I must say, these evening activities have been very, very useful to us all as health workers. And we keep encouraging each and everybody to attend and bring in more people from our respective associations. Thanks so much, Kaemba and team.
Thank you, Dr. Otara. Yeah, maybe we'd also welcome Dr. Kuoba to say something. And Dr. Kuoba. Okay, Kuoba seems not to be there. So from CPAC, I think so far I'm the only one who has joined. We don't have anybody from the panelists.
Please, I had started talking. Sorry, I think you couldn't hear me. Can you hear me now?
No, I couldn't. Yes.
Yeah, so sorry, I think I was talking to myself. So I would like to thank everyone who has made time to be with us this evening. We are always excited to share with all of us a few tips on how to deal with different issues during this season. And especially, I know for many of us who are parents, it's been quite a challenge, a new experience actually, dealing with the children who have suddenly had to stay with us for several months, while most of the time they are taken care of by teachers. And we are excited and we look forward to learning from Dr. Siengo, and I hope you're excited with us. Karibuni sana on behalf of Kenya Psychiatric Association.
Thank you very much. KPA is a major part of this collaboration as well, so we are glad to hear from some presenting. So now I'll go right to our speaker and panelists today. Our speaker, Dr. Siengo Mutisia. She is a consultant, psychiatrist practicing at Medical Association Center, third floor on Mara Road in Upper Hill. She's a consultant at the Mother National Teaching and Referral Hospital and a member of the medical board for assessing for fitness for further services and GPA cover session. She is also a director at Nairobi Parenting Clinic and Nairobi Mental Health Services. She was among the Business Daily 40 Under 40 men in 2010 and 2014, vice chair of Royal College of Psychiatrists, African International Division. She has been in the mental health force, finalized and disseminated a report on mental health in Kenya. She loves listening to music, dancing, reading, and also watching comedies. Karibu, Dr. Sia. But before you start, we will also introduce your panelists who and how we got stuck in traffic, but will join us shortly. And her name is Faith Masambia. She's a counseling psychologist with a BA in psychology and an A from James Madison University in the US of A. Pursuing a PhD counseling psychology at Kenyatta University. She's an associate at Nairobi Mental Health Services and runs a private practice at Center third floor. Faith has been applying psychotherapy for the past year and has vast experience with working with children, adolescents who struggle with anxiety, depression, and issues concerning image and self-esteem. She also works with adults who struggle with anxiety, depression, abuse, and relationship issues. In addition, she provides training in schools and workplaces on various mental health. I think without further ado, I'll welcome Dr. Siengo to share her screen and start her presentation. Karibu sana.
Thank you very much. Good evening, everyone. I hope you can all see my slides and you can hear me.
Yeah, we can, Dr. Go on. Yeah.
Yes, so the topic of today is rather a difficult one, which requires discussions on a round table. But it's good that we have a great team of panelists who will be able to discuss and answer the questions which will be raised. So you probably have heard about Nairobi Parenting Clinic. It was registered in 2010. Actually, the program we used, the Incredible Years, was a program meant to be for a PhD project, which didn't take off. It's called Incredible Years. You can find it on incredibleyears.com, developed at the University of Washington by a clinical psychologist. So Nairobi Parenting Clinic is located at KMA Center, third floor. and you can read more on our website about what we do. And we have a sister company, Nairobi Mental Health Services, which is now offering inpatient facilities, affordable, because we know very well that mental health services in Kenya are quite expensive in the private sector. So at Nairobi Parenting Clinic, our mandate is to promote social, emotional, and mental health for preschoolers, school-going age children, adolescents, and adults. And today's topic is about whether we should change our parenting skills and strategies in this COVID-19 period. But I would want us to just look at what is considered scientifically effective when it comes to parenting skills and strategies. I know I'm dealing with healthcare workers who are scientists, and this program, The Incredible Years, which I've invited all of you to go to incredibleyears.com and read about it. The basis of it is this pyramid, which shows on the base the things which should be done more, and at the top, the things which should be done less. For parents, including me, I'm a parent of 2 sons. The easiest, the solutions parents want is to be told how to discipline their child, how to set limits, how to make sure rules are followed, and how to punish the child when they misbehave. But according to the Incredible Years, which has been tested in various countries and in different races, we know that the skills and strategies which have been seen to be working, and this is a program which has been shown to be effective in preventing substance use among children and adolescents, is effective in preventing delinquency, is effective in preventing conduct disorder, and even for just giving parents skills and strategies for parenting. I know we only talk about strategies when we are talking about businesses, but even when we are parenting, we also need to strategize. So at the base of the pyramid, which I hope everybody can see, we need to spend more time with children. We need to talk to them. We need to use the things on the base liberally. Listen to them, teach them how to solve problems, play with them. And for adolescents, play means different things than when you're talking to a preschooler or a school-going child. Give them attention and basically spend more time with them. We say with children, love is spelled as time. So the more time you spend with them, the more they feel loved and the more you are able to bond. And when it comes to time to correct them, then you're already correcting a friend. We now moving towards shaping behavior by reinforcement, using praise and rewards. So as opposed to punishment, when we use liberally praise, encouragement, when the child does the correct behavior you wanted and you praise them immediately, I will be showing an audio on how to do a reward system to shape behavior. So for example, a child who delays in the morning preparing for school, that you can discuss with them, have a reward system, use stickers, and put a timer that if you dress in 5 minutes, you get this sticker. And at the end of the month, each sticker is worthy 50 bob, and then we can buy your favorite toy, but it has to be something the child wants. It could even be going to play with friends. It could be going to visit a friend, whatever the child loves. So you have to know what makes a child tick. So as we move up the pyramid, the other important thing is setting limits, setting clear rules, and consistent follow through. And many parents forget that rules should be known by everybody in the household and should change as the child ages. So you don't keep the same rules when the child is 3 years, 5 years, 10 years. When they're adolescents, the rules need to be changing. And then at the top of the pyramid, you see the things we should be using selectively, like enforcing consequences. So let's say you are supposed to watch TV for 1 hour and you watch TV for 2 hours. What is the consequence? Is the consequence that the following day you don't watch TV? Or we will be discussing about natural and logical consequences. loss of privileges. So if you did something wrong, which privilege do you lose? So it is very important for parents to understand that we need to bond with the child more, and that's why the parenting pyramid is a pyramid and not a rectangle or a square, that some things need to be done more. And then when you are enforcing consequences, you're already having a friend. And back to our topic, do we need to change parenting in this period? We know that with school shut down in Kenya, with only the exam class is going to school, it has been a chance to make relationship with our children and teenagers. And it is a time to have one-on-one time with each child. But unfortunately for health workers, and this webinar is meant for health workers, the other parents are staying home with their children, but for us health workers, we are supposed to be going to work. So I think parents who are health workers are under extra stress because the children are at home, they are not going to school. And normally they would plan for their holidays. And now children are at home, they have to do online classes. You are required to go to work. So that brings up a challenge specifically for healthcare workers. We should always remember to build a bank for your child the same way you open bank accounts for them. Every time you spend time with them, every time you praise them for doing something good, every time you start a reward system, every time you solve problems with them, like they are seeing you in traffic. Do you curse in the traffic? Do you find another route? Do you play music? They are learning how to solve problems. So every time you're depositing a coin into that bank for the child, and so when you need to withdraw by either enforcing a consequence for misbehavior or for losing a privilege, you're already friends. Again, I've said the things we should use more liberally is play, fun, attention to the child depending on the age, praise and encouragement, reward and celebrations. We know that in this COVID period, a lot of fun activities are no longer possible. But for those who have teenagers like me, if you ask them what they enjoy, like I had to buy dumbbells for my son for us to be able to exercise, and I ended up benefiting. We actually jog with him, and that as because he's an adolescent, I've had to identify the things he likes. So even with COVID, it would be very good to identify what sort of fun activities you can do with your children. Praise and encouragement. We know our children are also going through a lot of stress. Many of them ask, you mean the whole year I'm going to be at home? And we know even WHO and UNICEF have emphasized that children are better in schools despite the COVID situation. Now, many parents, when we do our classes, they want to know about setting limits. They want to know how to discipline their child. And when they bring their children to our office, they want to know, how do I discipline this child? Nimemchapa na asikii. And normally we encourage them to bond with the child, but at the same time set limits. And how do we set limits? Routines, by having a morning routine, an evening routine, actually makes the life of the child predictable. And that's why schools have timetables. So when a child knows that when they wake up in the morning, they take breakfast, they wash their face, like when it's school days, they dress up. When there's that routine, then it's easier to follow. In the evening, they know we wind down, we tidy up our toys at maybe 8 p.m. We brush our teeth, we pray for those who pray or read a verse, or we sing, or we do a lullaby. Then by 9, it's sleeping time. When there's that routine, then it's very easy for children to comply. Household rules I had mentioned must be clear, and they should be few, like saying no playing in the road. When you're riding a bicycle, you should put your helmet. When you're in a car, you should put safety belts. TV is only this time to this time. Electronics, I know it's very challenging because now our children are doing online classes. They have to use electronics. And this is a challenge now, our parenting skills. I remember when my children were young, I did not put Wi-Fi in my house. I had to use cable internet. But as they grew older, they needed to use the internet for school. And so we had to put Wi-Fi. So in this era, can you insist on cable internet and no Wi-Fi? And yet the children are supposed to be able to access internet. And if previously we were seeing 5-year-olds knowing so much about life, and now they are getting even more exposure to internet, what sort of changes are we going to see in our children? Again, we'll be seeing how to give effective commands. So like saying, please close your mouth, or please walk slowly, rather than saying stop talking or stop shouting. How to give those effective commands, how to make sure they are clear, how to make sure they are understandable as per the child's age. Handling tantrums, how a child learns, if I throw this tantrum, I'll get this. You're in a supermarket and child wants this and they throw a tantrum. How do you ignore that? How do you give time out for the child to take a break? Even as adults, we know the best thing is when you are stressed out, take a break. So it needs to be taught from childhood. How do you take time out to calm down? What about consequences? We know we talk of natural consequences and logical consequences. So natural consequence, you didn't carry your games kit in school, so I'm not bringing it to you. So you take the consequence from the school. Logical consequence is what the parent thinks it's logical. So you watched TV for more than 2 hours, which you are allowed. So logically, the parent decides that tomorrow you're not watching TV. So consequences are both natural and logical. Sometimes it's good to let the children face the natural consequences, and sometimes it's also good to let the children, the parent also enforce logical consequences. There are videos I would want to play, but I will see how much time we have. When we are saying that we need to do more of positive reinforcement of behavior rather than the punitive disciplinary shaping of behavior, especially at this time when our children are also stressed. So many people think if they praise their children for doing the right thing, they will spoil them. That is not true. I've told you Incredible Years is a program which has been researched widely among different races. We've used it in Nairobi because the setup in the city is more of urban and the lifestyles are the same. So it has been shown that when you praise your child for the behavior you want, then the behavior is reinforced. So catch your child being good and praise. Increase praise for difficult children. I have seen many parents who drag their kids to our clinic and the child is getting difficult and they label them and they call them names, and the child then lives to the expectations of the parent. And we also need to model self-praise ourselves so that the children can learn from it. Every time you're praising, you need to label what you're praising, not to say you're a good girl or you're a good boy. Just say, it's nice you've returned your place to the kitchen. So be specific. Again, if you've witnessed what teachers do in the kindergartens, patting themselves, hugs, kisses in the air, that's the same way we need to treat our kids at home when we are praising them. It could just be a pat, a hug, and you be specific what you're praising them for. And you should praise immediately, not that I've done something good today and you wait, you praise me tomorrow. And it should be consistent. And it's very important when you praise them in presence of others. Let's see if...
Sometimes parents worry that too much praise might spoil children or make them conceited. They also may worry that their children will become dependent on their praise and will need more of it to stay motivated. In fact, just the opposite is true. Thank you, guys. You played so nicely and research indicates that children who are praised internalize the positive approval and develop positive self-esteem, feel competent, confident, and seem to need less praise. Notice in the next vignette that when the boy is reinforced by his father, he has the confidence to go on and proudly show his father something else.
Good. Good for you.
Let me show you something.
What? It's a little bit big,
So we will be, if we have time, we can play more of those videos. Again, we said you can shape behavior through rewards. You define the appropriate behavior. Like I gave an example of a child who delays preparing for school. You could use a timer, have a program for rewarding when they dress in time, and focus on the positive behavior, but you need to choose inexpensive rewards, because it can get very expensive. I prefer that you have a budget as you discuss with the child about the reward system, and involve your child in choosing the reward, get the appropriate behavior first, then reward, and gradually replace rewards with social approval. It's important for parents to show their children that they expect a success, and you should not be mixing rewards with punishment, and you should be consistent and monitor the reward program. I just want to play a bit of that, and we see.
Young children often dawdle when dressing because they get distracted easily and have no sense of time. For parents who are trying to get children ready for school and are on work and daycare schedules, this can be very frustrating. Let's watch how this mother sets up a program to motivate her son to get dressed faster in the morning. Think about what makes her program effective. You do lots of good things at home, okay? Yeah. You're real good to your little brother, you do lots of nice things. But there's one thing that I think we need to work on, okay, that we need you to do better. And that's getting dressed faster in the morning, okay? Okay, and right now when I yell at you and we get mad at each other because you don't dress fast enough, that's not any fun, is it? And neither of us like that. Okay, I have a new idea, okay? Remember we used a star chart when you were getting potty trained? Yeah. Okay, how about a new chart with stickers? Okay, this is what we're going to do. I'm going to make a sticker chart, and these are the kind of stickers I got, and this is the chart I put together. And you can help me finish making it. What I'm going to do is I'm going to set this timer for 3 minutes, and then I'm going to leave the timer in the room, and I'm going to leave the room, and you get dressed. If you're all dressed by the time I come back, okay, and the timer hasn't gone off, you get to put a sticker on. Okay? Does that sound? No, you have to stick it on here. Well, because that's what the sticker chart's for. But maybe if you're really good at this, I'll let you have 2 stickers, one for your chart and one each day for your hand. One each day? Yeah, because we'll do this each morning. Okay? We're going to really do it? Yep. Each morning we're going to turn this on for 3 minutes. Okay, Ryan, how about if we start and we try this morning for the first time? We'll see how you do, okay? I'm going to set this for 3 minutes, okay? And I'm going to leave it right here, and you can start getting dressed, and I'll be back to see how you do. Okay?
So for the sake of time, that child dress is very fast if you watch the whole video. And that's just an example of how you need to shape behavior by reinforcement. That boy is very excited when he's told about the sticker system, and he gets very excited and he stops disturbing the parents when he's preparing in the morning for school. Again, I said when it comes to positive discipline, what we call setting limits, it's making sure we have routines, household rules, chores. I think I'd already talked about that. And I'd mentioned that setting rules and routines will help children adjust to the school environment where there are timetables, and routines help children to comply with the rules at home and school environment. And it's important for every home to have a routine for morning and evening, because sleep is very important for children. I had been told 30 minutes, so I need to rush. Those are videos I would have played about household rules. Every home needs a limited number of rules. If the list gets too long, no one will remember. The rules should change as circumstances change. Some of examples of household rules. Household chores, children need to learn chores and need to be, that teaches them responsibility. So you should have household chores. Remember to give effective commands. We said give one command at a time, use do commands rather than stop commands, and make the commands positive and polite, and don't use stop commands like stop shouting, or again, give children ample time to comply, give warnings, don't threaten the child, use when then command, and I'll give you a video to demonstrate that. Give children options or choices whenever possible, make commands short and to the point. And it's important to support your partner's commands so that one parent doesn't say this and the other one says the other. And you should praise compliance or provide consequences for non-compliance. So I think this is important.
A command that is particularly effective is a first then or when then command. For example, when you finish cleaning your room, then we can go to the park. This type of command informs the child in advance of the positive outcome of following the parent's request. This makes it more likely the child will cooperate because he knows what to expect and can feel in control of his actions. Remember the first then principle. First you get the appropriate behavior you want, and then you provide some kind of... Here's an...
Again, we are talked about handling tantrums. Immediate solutions is ignore and distract and redirect the child. I would have played that, but I don't think we have a lot of time. We talked about timeout, which is an effective way for children to practice calming down strategies. And timeout basically involves the child going to sit on a chair in a corner, in a room, or in a boring place for about 5 minutes. The aim is to teach self-regulation. I would have also played that, but we don't have time. We are talked about using natural and logical consequences, and I defined a natural consequence is whatever would result from a child's action. So like I'd given an example, you didn't carry your swimming costume, let the school deal with you the way they deal. You didn't do your homework, let the school deal with you. And a logical consequence, on the other hand, is designed by the parent as the punishment. Make the consequences age appropriate. Be sure you can live with the consequences. I've had parents tell the child, if you don't stop crying, I'll leave you here. You know very well you can't leave your child in a supermarket. So you're giving a consequence which you know you cannot enforce. Make consequences immediate. Give the child the choice. So you warn them that I've noted this is you're watching TV more than the time I've given. And if you continue, if you don't stop watching TV in the 2 hours we've given you, then there'll be no TV the following day. So you have warned them and you've given them a choice. Make consequences natural and non-punitive. Involve child whenever possible. Be friendly and positive. Use consequences that are short and to the point, and quickly offer new opportunities. I've seen parents who have withdrawn their adolescent's phone for a whole year, when you could have done it maybe for a week and given it back so that the child can learn how to behave. Again, that's a slide I may not have time to show. Problem solving. Children need when children are born, they do not even know how to identify their feelings. They don't know when they are sad that they are sad. We need to help them be able to identify their feelings, help children define the problem, involve them in brainstorming, model creative solutions, and encourage children to think through various consequences. And remember, it's a learning process. So I just want to play a summary of the program we offer for below 12 years, because we know that after 12 years, then now the child listens to the peers more. And at adolescence, then we prefer to deal with the child directly. But below 12 years, the parents would be the best influence.
In order to cope with the inevitable frustrations of parenting, it is important that parents find support from their partners. When you come home, are you willing to take them right away, or with friends or other parents and family members? It is also important to find ways to refuel your energy so you can stay consistent and predictable in your responses. You may want to view the advanced program to learn more about ways to give and get support and problem solve. In the Incredible Years parenting programs, we have talked about promoting your child's social and emotional self-regulation skills, their positive attachment with you, as well as their independence and autonomy, while at the same time keeping them safe by supervising their activities. Let's review a few of the principles we have discussed. Be warm, positive, and loving. Show your children you enjoy them. Build a strong foundation to your relationship.
Kalani had a turn, you picked Skidmarink, and Nika's gonna pick one.
Use academic, social, and emotional coaching strategies during regular playtimes with your children. This coaching will teach your children how to be friendly, how to communicate, and how to solve problems. Model and be respectful in your interactions with your children. This will teach them to be respectful with you.
Yeah, I think you're right.
Praise your child's positive behavior and cooperation often.
Good job.
Plan for rewards and celebrations for special achievements.
Yum, Egg City.
Structure your child's day with predictable routines for bedtime, morning time, and meals.
Use a book like we have.
Use redirections, distractions, and choices to preempt misbehavior. Avoid too many commands and no's. Set clear limits and household rules when needed to keep your child safe and follow through with your rules. Withdraw your attention and ignore child misbehaviors that are not hurtful to others or to themselves. Use a brief timeout to calm down when your child is aggressive. Provide constant supervision and a safe environment. Help your child to learn to problem solve by modeling, prompting, and teaching your children pro-social solutions to problems.
Thank you. Good job.
Think about your child's developmental abilities and temperament.
I guess I'll put my X right here. No, you have to put it on him.
Be patient and adjust your expectations accordingly. Remember, every child is unique on his own developmental timetable. Be patient and remember children are striving for independence and are not misbehaving deliberately.
Please let Robin have a turn now.
Trust your judgment and use the parent management strategies and principles you have learned. And finally, get support from other parents and take some time for yourself to refuel your energy.
Thank you.
So thank you very much. For more information, you can go to our website, nairobiparentingclinic.co.ke. We also have a blogspot, Nairobi Parenting Clinic blogspot, and we also have a YouTube channel, which you can watch some of the videos we've done. Thank you very much.
Thank you very much, Dr. Siengo. That was a wonderful presentation. I especially enjoyed part about respecting our children. From an African thing, sometimes that is respect the children is usually a very alien term for many of us as parents. And I've seen Faith joined us, so we'll do the Q&A and redirect questions to what our participants are asking. So this first one, I'll ask you, Dr. Siengo, how do you ensure a reward does not turn into bribery? How do you ensure reward does not turn into bribery? That's asked by one of our attendees.
Yes, every time we make these presentations, that question always comes out. And I keep telling parents that reward, you plan and give it after, but a bribe, you're doing something illegal in the first place. But again, we know that even when we go to work, we are going to work, we are expecting a reward at the end of the month as an income, or when you're serving people, you expect. So reward has been shown to shape behavior. It's not a bribe as long as you are not giving it before. So, and that's why I played an audio on first, then command. So get the behavior first, then you reward, as opposed to a bribe where you give before. Thank you.
Thank you, Dr. Siengo, for that answer. That has been answered. So we have another question, which I will ask the panelists, Faith, to respond to. Dr. Jane Nyapara asks, fast and then approach feels to me like blackmail. I have used it with my son and he pulled the blame on me, felt he was blackmailing me. Any comment on this?
Yeah, I think that goes with the same answer that Dr. Catherine gave up there. The best way to make sure that this does not turn into some sort of blackmail, first of all, you want to, Dr. Siengo mentioned that you want to make sure that you're working on this with the child, that when we're deciding on a reward or on a consequence, that this is something that is mutually agreed on by parent and child, and the child is able to clearly understand why are we, when are we going to be implementing this reward, and when are we going to be implementing this consequence. Okay, so in the same way, if the child is able to clearly understand why this is being used and when it is being used, then I'm guessing it will not look a lot like a blackmail.
Okay, thank you very much, Faith. Dr. Nyapara, I hope that answers your question. There's another question here. Is there a place for those quick, continuous, small steps, especially to the younger ones? Should we slap them, or should we just leave? Dr. Siengo, maybe answer this one first.
Yes, a very common question, because that's how we were parented. And you know that even schools are about load caning. Scientifically, it is shown that if you teach a child that every time they misbehave, then you cane them, then you're teaching them when they disagree with someone, they should resort to violence. And we encourage that we use more of the consequences and loss of privileges and timeout, as opposed to the caning. Yes.
Okay, thank you for that question. There is one question here. I don't understand very well, but maybe you. Tutu asks, how do you make sure that the reward system is not dependable by the child? I don't know whether maybe she means the words does not become addictive, or the child doesn't depend too much on it. What do you respond to that?
You remember when I was presenting, I indicated that you should gradually replace the reward with social approval. And with children, you find that this time you are potty training them. Then now they start going to school, you discover that they are delaying preparing for school. And from there, you discover they are delaying doing their homework. So you gradually move. You're using reward system for potty training. You moved to preparing for school. You move to completing homework. You move to completing their chores. So you have, that's why we are saying with parenting, you have to keep strategizing. It's not that you decide this is how I do things, and for the next 13 years, that's how I'm going to do things. So you have to gradually change to more behaviors you want to see, and you should also be replacing it with social approval.
Would you please define for us voice?
Sorry?
Would you define for us social approval? How do you define social approval?
Social approval, like, that was great. I'm proud of you. Just praising socially without necessarily rewarding. Remember, we are using reward for difficult behaviors. Like those of us who have children going to school, I know you struggle when kids are waking up in the morning and they have to be on time to go to school, and you also have to go to work. Many parents, working mothers and parents and fathers struggle with that. You're dropping your kids to school, or they are getting a bus. Many people struggle with that. So its reward system should be put for difficult behavior, not for all behaviors.
Okay, social approval is maybe synonymous with this.
Sorry, maybe Faith can respond to that.
You disappeared for a minute there, Liz.
Okay, so I'm wondering, social approval would be synonymous with praise?
Yes. Social approval would be synonymous with praise, yes.
Okay, great. Okay, so into the next question. I'll ask in chat. So somebody asked or said, it's becoming increasingly difficult to contain within the homes. You want to limit the screens, but having done sports and the mornings, the rest of the day is left with nothing to do. How does one? The children aren't keen on academic class simply because they repeat. So the attendance is just like a box. I stopped paying as I really didn't want to continue. The teenagers who are 17 and 14 increasingly want to go into their school friends' homes, friends whom we as parents don't know. The end result is unceasing conflict with the teens. How one as a parent cope? Dr. Siengo?
Yes, and those are the challenges we are saying have been brought by COVID-19, because if it wasn't for COVID, our children will be going to school and they will be able to even visit, will be able to do fun activities. I hope I heard you clearly that the parents said they are tired of paying for the online classes. I hope I heard that. But again, sorry?
They stopped paying.
For online
they
classes?
Stopped paying, yes, because children don't want to.
Okay. I think it's very important to keep emphasizing to children that learning is not just for exams. Yes, you're not doing exams. And even if you're not learning the academics, you could opt for things they like. For example, they like cooking, they like reading, they like reading. They can even enroll with them, depending on the age, you can enroll them for an online program and make sure they are doing something. And again, that's why UNICEF and WHO is insisting that children are best in school. In the West, schools were opened in September and they are still open, despite the fact that their numbers are higher than ours, their deaths are higher than ours. Schools and universities are open. So there's a reason why, because even the Minister for Education the other day gave an example and said, look outside, the children playing outside have no masks, but the ones in school are wearing masks. So children are better in school, but the situation is as it is. We have to live with it as it is. So find a way of having these children engaged, get a way of getting them out, either to jog or go to, even you can go to Nairobi National Park, you can take a walk, you can jog, you can go to Arboretum, you can cycle. There are many things you can do. Yes.
Thank you very much, Mary. Maybe I'll give Faith 2 or 3 minutes in case she wanted to. Our panelist.
Liz, I'm sorry, I didn't hear the last bit that you say. You said you kept disappearing.
Do you like to add something?
Not really. I think the slides that were presented by Dr. Catherine really covered some very helpful tips as about how to parent through this pandemic. I know it's not been easy. Sometimes having to balance being at home, working from home, or as health workers having to be away from home for extended periods of time, and parenting at the same time. So I think the slides that she took us through were really good and helpful, and I've definitely learned something. So I hope the participants have also learned something.
Yes, most definitely. We have also some comments. Somebody would like to get presentations, and just to inform all participants, the recording will be on the KMA face page, so you can put up any time and go through it again. Perry Murugi says very educative presentation. Once I can get the presentation on the KMA Facebook page. Faith Mutisia says very good presentation. I think for slides, which you can get for the rest of the presentation. So any other questions from the panelists, the participants as we close the session? Someone is asking about CPD points. If you have registered for the webinar, the CPD points will be sent to your email. So this will happen, should happen as soon as tomorrow. So just be patient. Don't get them. You can tell us KMA and you will get the yeah, we'll continue. So now we would like to end the webinar.
Hello, just a minute.
Yes, Dr. Somba.
Hello, good evening.
Good evening.
Good evening.
Yeah. Well, I think I just want to add one or two things. Huh? This was a beautiful webinar, and I'd like to thank Catherine for really bringing up these issues. And I'm happy to note that there is a Nairobi parenting clinic. So for all of us, especially the aspiring parents or the young parents, I think for those who may not have knowledge on how to bring children, I think you can consult Dr. Catherine for details on this. And I'm also happy to note that there is this incredible years document, which allows everybody to read, because parenting is a very, very difficult thing. We came at during our time, there was a saying that, would you say, spare the rod and spoil the child. Yeah, and all of us, went through that, and maybe we can look back and say we are given a good discipline, and that's where maybe some of us became doctors and we understood things well. But now the challenges are very complicated. I was just wondering whether Catherine can give us a small talk on the issue of different cultures, mixed marriages, especially tribes and race, and the young parents. It becomes very difficult to bring up children in this kind of setup because, the culture, one comes from one side of the country, the other comes from this side, or race. Just give an insight, how do you bring this kind of children? And just also last thing to say is that I think what she's talked about children in the urban setting. But rural children, a lot of them, they seem like they come up well than urban children. I don't know whether I'm right or wrong, but we find like our setup here, we found the children are busy when, okay, they have something to do, taking care of animals, helping the chores at home and things like that. And they don't seem to have extra time to watch some of those things that we're hearing from Catherine. So maybe just a comment on that. And then lastly, the video that she showed, it was more one gender. Looks like the mothers were busy, are the ones who are relating very well with the children. But there's no mention of the other gender, the male. Do they have a role? Because we saw just the man, the ladies with the children. I don't see many men in those videos. So the question begs, is it they're rating more, is the child rating more the mother, or the mother has a bigger role to play than the father, or what? Others, thank you very much, Catherine. I think you have gone a lot. And for the young people, they are aspiring parents. Please make sure you attend to this Nairobi parenting clinic and learn, because parenting is a very, very difficult thing. Thank you very much.
Thank you, Dr. Somba. Maybe Dr. Singo, you can respond to those questions.
There were many questions. Unfortunately, I didn't put them down, so I'll see what I can remember. I'll start with the last one about the fathers not getting involved. I think one of the audio we had on praise was a father praising the son. And that brings me back to the mental health task force report we gathered. When we went to most parts of the country, we were being told that the boy child is being left behind. And we've brought a very interesting discussions. Is that really true? But what is coming out is that the boy child needs a lot of role models from the males. We are also seeing that divorce in Africa setup was not there. And when it came, many of people who are divorcing, they think they're also divorcing the children. So you find when parents divorce, when couples divorce, it's like they do not know how to co-parent. So you find a boy who was an absent father, but even the couples who are living together, you find that fathers are not involved. And we recommend that every parent and most of fathers, remember, at least aim to have a meal with your children. It could be breakfast, it could be supper. Plan a fun activity once a week and plan a holiday once a year with your children, especially the fathers. They are very important. You go to school meetings, you find only mothers. That is not the norm. And that's why probably we are seeing, when you look at like medical school, you're seeing more girls than boys. So we need to make sure that the boy does not lag behind. The other question you asked was about race and whether this program applies in different races. For us, when we were looking for a program, we were in Nairobi and we were looking for a program which could also help with the urban setup. But we also know even in the rural setup that even the mothers and the fathers work even in the rural setup. They might not be talking to their children in English, but definitely the same principles happen. I treat adults and Faith also treats adults. We've seen many adults who have problems because of what happened in their childhood. They were called names by their parents and it stuck. And this person has achieved, they are doing very well in their career, but as an adult, they're having problems because of what happened in childhood. It doesn't mean because we've become doctors that we have no issues to deal with. So I don't think entirely that if you grow up from the rural areas, that you have no problems. We are also treating people from all over the country. Yes. Did I forget any? There were many questions.
I think you've answered them. Thank you very much, Dr. Siengo. There is a comment here from one of us, from Dr. Stella Kubasu, where she says, thank you, Dr. Catherine, for the great presentation. And for parents of older children, parenting young adults of ages 19 to 28 remains a great challenge, especially with alcohol and drug abuse. These are still children in some homes. This group is giving parents a hard time, and they need and benefit from structure, guidance on useful friendships, participation in consequences, financial obligations, and budgeting. All these Dr. Kubasu feels are necessary, and I agree. It is clear really that childhood is stretching out quite a lot, and our children remain home sometimes for lack of jobs for longer periods. But we really do need to continue parenting them appropriately according to their developmental stage. So I'll just check if there's any other question.
I can see a question on the chat by Jacqueline
Anundo. Yes.
And she's asking for a comment on teenagers and too much sleep, and how can parents deal with that? I think maybe the first question to ask is try and understand what is making your child sleep in. Are they sleeping in because they're spending the entire night on the internet watching movies until late? And if that is so, can you set up some sort of structure within the home that at a specific time, all electronics are switched off? We're switching off our TVs, our computers, the Wi-Fi, and we all get into bed at 10. And at 7 o'clock, we all wake up and have our breakfast together or do whatever activities together. So I think one of the ways that parents can deal with that is coming up with a structure within the home in terms of regulating sleep, creating a healthy sleep routine for the teenagers especially, so that maybe they're not sleeping in. And maybe Dr. Catherine can give a comment on that also.
Yes, I agree with what you've said. But also the parents to note that during teenage, the need for sleep is more than earlier. I mean, in the school age, they tend to sleep more. But again, many of them are also on electronics at night. So it's very important that you make sure that they are not using their electronics and they are awake, they are sleeping at 3 a.m. and telling you they are still sleepy at noon. So it's very important, and it's very, with this COVID-19 period, it's also a challenge to enforce that. Yes.
Okay, thank you, Faith and Dr. Siengo. I think we have finished with our question and answer session. And just as we close, as we end, I'd really like to thank our speakers. This was a very, very important topic. A lot of parents are struggling, and we see as psychologists and psychiatrists, we are seeing a lot more children with many, many issues in our clinics. So just helping parents on some skills they can use before issues become more difficult is quite important. And just before we close, maybe I'd like to take this opportunity to talk about the call center and also ask Dr. Kigondu to prepare to give some closing remarks for us. So the call center is still operational, and we are still taking calls from healthcare workers. We've been open now for the past maybe 4 or 5 months at the call center. And we still wait for our healthcare workers to call, because we find that healthcare workers believe that they do not want to seek too much help, especially psychologically. But we realize that these are hard times, be it a health worker who's dealing with parenting issues or work issues or just stress and anxiety or depression or family issues. The call center is run and managed by medical staff, people who have trained in mental health in the medical field, medical psychologists, clinical psychologists, nursing, mental health specialists, clinical officer mental health specialists. And so we really do understand what our healthcare workers are going through. So we really, really encourage you to call. And I'm sure at some point, Peter will put for us the poster. Peter, the numbers that will be posted are the numbers that you can call if you're going through anything as a healthcare worker, and we're here to support you. So Dr. Kigondu, would you like to close for us?
Thank you very much, the team. Thank you, Catherine. Catherine is doing a fantastic job. And indeed, COVID has made parenting a little more difficult. And I can tell you that from my wife, she runs a rehab, and we are increasingly seeing more and more children coming for counseling services, and more parents are actually calling in to have a bit of counseling services for their children. Therefore, this topic was very timely, and we want to thank the speakers for a very elaborate presentation, and we will be bringing more of this. Thank you very much.
Thank you, Dr. Kigondu. Thank you very much, everybody, for attending. We hope you have your takeaways. And next week, please remember to come back. We are having, we will be having another topic which will be sent via email to you. Please note the CPD points will be sent also on email as from tomorrow. Once again, thank you and good night.
Good night.
Good night.
Bye.
Thank you.
Bye-bye.
Good night.
Good night.
Good night.